For example, it is very well known that when we use any AI models, we need to use an unbiased data set, large enough data set, which can be applicable across different ethnicities. And you also develop a model in such a way there is an explainability component into it, right? And you always take machine learning ethics, patient related ethics, and physician into it. You need to gain both the patient trust and also the physician trust whenever we develop any SAMDs, right? And of course, go through the regulatory approvals, then put it out into the market, right? Now, AI development fast, again the same thing, reiterating, development process, we are all aware about, those who are in a technical domain, or software domain, AI development domain, we all know about this part. But what is more important to gain trust with your doctors is the validation part. Where is your AI is going to be utilized? I'm not talking about the validation that we do in a training testing data set, right? Now, I'm not talking about that. I'm talking about the real world evidence, your performance of your AI models in your deployment settings, where you're going to deploy it. Are you going to deploy it in a primary healthcare centers, family healthcare centers, or in a diagnostic regions, or in a tertiary hospitals? Wherever you may be, it needs to be clinically validated and proven, and it also has to be worked across different ethnicities. In India itself, the phenotype changes a lot, right? So your model should consider all this, and your model not just in your data set, but make sure it is completely validated as well, right? So what we do is this. We have a camera, a fundus camera that looks like that, completely handled. At one end, we attach an iPhone, and other end, there are optics aligned in it. We put it in front of the eye and click a button. It's a simple to use device. Anyone can use it. Once you click a button, you get a picture of the retina, and we build the AI models like this. Now, here are the couple of things we did. Number one, we deployed the AI model on the edge, meaning images taken on the phone are not transferred to your internet. The AI runs on the phone. So you don't have to worry about the data security part here. Your data stays with you, right? The AI runs on the phone and brings an output like that. Not just that, you can also see the class activation maps there. Now, the class activation maps is to reassure your ophthalmologist or physician saying that, look, I'm saying this as a diabetic retinopathy because AI saw these regions to be abnormal. Now that reassures a physician or ophthalmologist saying that, okay, there is an explainability component. Why this AI gave me a positive or negative diagnosis is based on this, right? So that's how we built it, trust with them. So as you can see, it can be done anywhere. You can go to the doorsteps and just take a camera, point and shoot the device. Now, with this, we have built 3 AI models deployed now. One to detect for diabetic retinopathy, which is a complication of diabetes. Another is glaucoma, which is a severe eye condition, which most of the time do not have any symptoms, and age-related macular degenerations. All 3 are sight-threatening eye conditions. Now, diabetic retinopathy, it appears in 1 in 3 diabetes. 1 million people are affected with diabetic retinopathy, and there are 422 million people with diabetes, right? And anyone with diabetes diagnosed needs to have diabetic retinopathy screening, because 0.0, the chance of having the diabetic retinopathy is already 10%, right? And if you don't screen for them, then it's going to increase. So what we have done is we have developed a model. Like I told you, not just we left it there, we gained trust by doing a validation across different settings. We looked at where is our model is going to be deployed at. We are going to deploy it in the community setting. We are going to deploy it in the tertiary eye care settings. We are going to deploy it in the diabetes centers. At each settings, what is my sensitivity specificity values? We did a clinical validation of it before putting out into the market. We also tested it across different population. You can see there is a Mexican population. You can see there is an Armenian population, UK, Dominica. We went across globe and then we validated our software before putting it out into the market.